Hello and welcome to Medical Dialogues show. I am Dr. Nadita Mohan, and 4th of February every year is marked as the World Cancer Day, and this is basically aimed to raise awareness of cancer and also to encourage its prevention, detection, early detection, and even treatment. So, as a leading international awareness day, we have today with us who have joined us an esteemed panel of guests. We have with us Dr. Nitin Gupta, who's a senior consultant at Rajiv Gandhi Cancer Institute, Delhi. And also we have Dr. Peush Bajpai, who's the HOD and consultant medical hemato oncologist at Manipal Hospital, Dwarka. Welcome to Medical Dialogues. Sir, we are really happy to have you on board here with us today.
Yeah,
Thank you.
Thank you.
So, as we are marking the World Cancer Day, Dr. Piyush, if you could just give us a small brief on what progress has been made in India in the recent years in terms of cancer care and also the treatment accessibility. What is your take on it?
So there is a remarkable change what I'm seeing over the past years which has actually happened, and India is actually getting benefited with the science progress which has taken place in cancer care. One thing is, of course, awareness about cancer. So that I feel that there is an increase in, awareness in the metropolitan cities at least, and because of the messages and the social media, whatsoever reason, the early presentation of cancer, which was something which we were emphasizing on, that we can actually cure cancer if it is diagnosed, but you please present in early stage. We used to tell this as a public message, and this is now being realized in metropolitan cities. Apart from that, when we talk about after diagnosis treatment, treatment was something which was actually a bit elusive because of the cost of the drugs and because of the long nature of treatment. So people used to exhaust a lot of their finances. Good thing is that now even the government sector as well as the private insurances both are increasing, and the awareness that cancer as a disease process, so people are becoming sensitive, and policymakers are becoming sensitive about it, and there is now insurance like Ayushman Bharat is helping a lot of patients all over India. Apart from that, of course, the drugs are becoming accessible. The generic market is growing. So likewise, biosimilar, which we call as the monoclonal antibodies, that also is actually growing. So Indian pharma industry is also stepping up and pitching into the need for it. What the Rakino was for this connect the gap. So now this is happening, and the prices of these drugs are now more approachable, but still more needs to be done. We need to actually go to the second and third tier cities to spread this awareness, where a lot of thing needs to be done. Beyond this, of course, rural areas also screening programs should also catch up the way it is actually going in metropolitan. Also the insurance, we need to actually build more robustness into the whole thing.
Great. So, Dr. Nitin, if I may ask, in what ways is the healthcare system in India actively working, as Dr. Piyush mentioned about the gap in cancer detection and also early diagnosis? So, what ways is the progress happening in our country?
So, as Dr. Piyush rightly mentioned, early diagnosis of a cancer is the key to cure. So if we pick up a disease at a later date, then majority of times the disease is beyond care. You are looking at palliation, right? So the healthcare system in India, even the government bodies like the DBT, they are actively supporting trials for early detection of cancer. For example, we have just submitted a trial for early detection of gastric cancer with the help of endoscopy and various biomarkers, and the DBT is supporting us on that. So there are government sector and NGOs which are actively involved in spending money on research for early diagnosis and further treatment. And in fact, when you look at the government hospitals, maybe 5 years from now, I don't think there was a dedicated cancer center, or maybe 8 years from, or 8 years earlier, I don't think there was a dedicated cancer center other than IRCH in Delhi. Now you look at the government sectors which have a dedicated oncology department, and you actually have oncology hospitals that are run by the government, like the AIMS Jhajjar setup. So government is actively involved in bringing oncology treatment to the general population who can actually not afford the private setup. So there is a definite improvement in the attitude, the spending, and the intent of diagnosing and treating cancer in the government setup as well. So the healthcare system has improved over the past few years. Yes.
So this could also be one of, as you mentioned, there is an improvement in the healthcare towards oncology. So it could also be a reason that this is happening because of the increase in the number of oncology cases that everyone, or there is an marked rise of cases in the country over the past few years. Could that be one of the main reasons why the government is actually aiming towards establishing oncology centers?
Yeah, probably. With an older age, with the age life expectancy increasing, the number of deaths because of infections, etc., going down, and people are living it to a older age. So yes, you would have a more greater incidence. But then now, with increasing awareness among the patients for their symptoms, we are also picking cancers more commonly. So it is both. It is detection as well as probably an increased incidence. Yeah. That's what I would believe. Dr. Peush would be knowing it better, because he would, I think, definitely shed some more light on that. So, Dr. Peush, please.
Yeah. So, sorry, your question was whether the cancer incidence is increasing.
Yes,
right?
yes. So, as Dr. Nitin had mentioned, that the government is actually working towards establishing more of oncology centers. Specifically, as he mentioned, AIMS Jhajjar is working towards that, and that's one of an establishment having oncology centers. So, it could be a reason because of the increased incidence of cancer that the government is actually striving towards establishing more such centers.
Yes, we have now data actually from the various cancer registries that yes, there is an increase in these cancers. Now, this could be, as what Dr. Nitin just said, that it could be actually more of reporting. But having said that, it is not just more of reporting. We are seeing that there is an actual rise also in certain cancers. For example, breast cancer, it is rising almost every year. The numbers keep on increasing, and almost to a tune of, it was 1.6 lakh in 2020, and now 1.72 lakh, in just 2-3 years. So something is actually there, which is showing that yes, lifestyle which is there, a different lifestyle, adoption of more fast food, lesser exercise, obesity, metabolic syndrome, all this is contributing somewhere to increase in lifestyle related cancers in particular.
Great. So now, if you're talking about cancers in detail, I would throw a little light about liver cancer, pancreatic cancer, and even bile duct cancer for that matter, considering these are one of the fastest growing cancers. Dr. Nitin, if you could just explain the available treatment options for these cancers, including their diagnosis, surgery, chemotherapy, and even the upcoming targeted therapies that we're talking these days.
So yes, I think one cancer which has grown in treatment over the past few years, that's one of the most common cancer, is probably liver cancer. Now, liver cancer is not, now it has become such a multidimensional treatment with all the fields pitching in. It is no more a gastroenterologist's domain. So the gastroenterologist's domain is predominantly to diagnose it, and we have got good imaging facilities. We've got MDCTs, we've got contrast liver specific MRIs, which can pick up liver cancer at an early stage. And in fact, when you look at the treatment options, they include surgery, which could be just resection or maybe liver transplant. Then there is the branch of interventional radiology, which has become a significant contributor to the treatment of liver cancer by doing transarterial chemoembolization or radioembolizations. And then the chemotherapy and the new targeted therapy, which has grown up in the last 5 years, is significantly improved. So when I was doing my residency, the only drug I knew of was sorafenib. Now I think there's a plethora of medications that have come up, and Dr. Piyush has much more experience in that than me. So I would request him to just go ahead with the discussion on the targeted therapies as well as the chemotherapies.
Thanks, Dr. Nitin. Yes, of course, there are other drugs beyond, sorafenib. But the thing is that yes, liver cancer still is one challenging domain. Immunotherapy is coming in a big way, but still we need to do more research, and we need to develop more molecules. Yes, the survivals have improved in advanced liver cancer, but more so that realization that a multidisciplinary teamwork is so important in complex cancers as these. We need a team to treat these cancers. We need tumor boards to treat these cancers. Beyond the good drugs is the realization that doctors need to work as a team, and that is making an impact.
True. So, Dr. Piyush, now that you're talking, as Dr. Nitin mentioned, liver cancer is one of the fastest growing ones. Coming to pancreatic cancer, if we talk about the targeted therapies that we are just mentioning, which have started to which are coming up in the past 5 years. Are these targeted therapies or immunotherapies even showing promise in the treatment of pancreatic cancers?
Okay, now I would first cover targeted and immunotherapies in general, and then in pancreatic cancer that you asked. So immunotherapy and targeted therapy. So I'll talk about immunotherapy first. Immunotherapy is a drug which is actually sort of energizing our sort of subdued immune system, and catalyzing it to work against or take action against cancer. So basically, these are T cells which get activated. Now, immunotherapy primarily found its role majorly in skin cancers like melanoma, and then eventually in lung cancer. It has big role to play in today's day. Bladder cancer. So these are certain cancers which are immune hot basically, and where immunotherapy acts well. On the other hand, pancreatic cancer is not such an immune hot environment. When I say that the immune hot environment, what does that mean? That the immune cells can actually infiltrate the pancreatic tissue, or because of the complexity of the pancreatic tissue, it has the collagen deposits and the connective tissue basically around the pancreatic cancer, basically inhibits these immune cell penetration. So it's not a very immune hot tumor. Coming to the targeted therapies likewise, the first targeted therapies which have shown immense development and immense promise in a disease like CML. The imatinib was the first drug which actually was there in the Time magazine in 2000 for its treatment in CML, and then breast cancer, HER2 positive disease subset like trastuzumab, this particular molecule, and then a lot of molecules followed. For pancreatic cancer, the realization that there are certain set of targets, for example, breast cancer related gene target, BRCA. It was this particular gene, we discussed that this is most commonly mutated in breast and ovarian cancer patients. However, in pancreatic cancer patients and prostatic cancer patients also, there is a mutation in this gene in a tune of less than 5%. So if we look towards these mutations with the help of NGS technology, which is next generation sequencing technology, we can actually detect these. And also, family history is so important. It is not that if no family history, then these genes should not be detected, but family history is also important, and therefore it adds to suspicion that you should check for these genes. So the breast cancer related gene, BRCA gene, has now a target in pancreatic cancer. Likewise, Lynch syndrome, which is actually another syndrome which causes several subtypes of cancer, is also found in a small few percentage of pancreatic cancer patients also are affected with Lynch gene. So their immunotherapy can work well. So these are small targets which are coming up because of better understanding of DNA, which is precision medicine.
Okay, so I guess I believe the case selection is that which plays an
Yes,
important role if
very
we have to
important.
definitely look out for targeted therapy or immunotherapies. Definitely, that is one important aspect. Dr. Nitin, now if I may ask, so if we're talking about liver cancer, pancreatic cancer, bile duct cancer, so are there any advancements apart from the ones that we just mentioned in the treatment aspect of it that actually are showing quite promising results?
Since I'm a gastroenterologist, as far as chemotherapy and targeted therapy is concerned, Dr. Piyush would be a better person to answer. Yeah, some things that have, as we said, for any curative intent for a cancer, you need to
Mhm.
detect it early. So, as far as gastroenterologist domain is concerned, as our field is concerned, with new equipment, with more accessibility of the latest diagnostic techniques like endoscopic ultrasound and good imaging facilities, now we are able to pick up cancer at an early stage. And actually we can pick up the local staging of the disease can also be done. So this advancement is definitely helping us in picking up early cancers and thus improve contributing to a better diagnosis and a better treatment as far as gastroenterologist's domain is concerned. Also, with improvement in surgical techniques,
Mhm.
the the tumors which were initially considered unresectable or were sent for palliative treatment, now more of these tumors are being considered for surgical resection with a curative intent. By curative intent, I mean we are expecting the patient to get cured of disease or a survival of more than 5 years. So as far as medical treatment is concerned, Dr. Piyush would be able to definitely help better. But I would like to add one more thing, Dr. Piyush, as you mentioned. Now you asked me about what is the government sector or what is the healthcare system doing about picking up for improving the treatment of healthcare cancer. So one thing that is people have started realizing because of more and more information is genetic counseling. Now so many patients are now turning up to us directly who have a family history of cancer, whose brother has died of cancer at an early age. They are coming up for an elective genetic counseling so that we can counsel them whether they are at a risk of developing a similar cancer or a different cancer at an early stage. And we, in fact, in Rajiv Gandhi, we have a dedicated genetic counseling department. So this is one thing that the people should know. If they have a patient or a relative, close relative with a cancer detected at an early stage, they should definitely consult the genetic counselors for that. That can help them in prognosticating whether they are at a risk or whether any specific investigations need to be done to detect the cancer early. So that is one information for the public that should definitely go. Dr. Piyush should also be definitely help us comment on that as well.
Yes, Dr. Piyush, anything you would like to add on, as Dr. Nitin mentioned about genetic counseling? That is one upcoming aspect, and I think awareness is what which is lacking in that part. So, if people have a family history of cancer, then genetic counseling would definitely help them, isn't it?
Yes. Yes, of course. Whenever we actually, in fact, ask for this particular test of hereditary, testing,
Mm-hmm.
before that, genetic counseling is so important to understand the implications. First of all, understanding the family history is important, and then uh, people are apprehensive, and therefore, before doing this test, a pre-test counseling to make them understand that what are we eventually going to achieve, and once we achieve a positive or a negative result or an indeterminate result, then what consequences would be there. Because sometimes with a positive result, one needs to understand that one would have to undergo, or a surgical intervention or a medical intervention, or be under surveillance. Is the individual prepared for that? So all this should be done after a proper counseling. Then only the individual should take the test. For example, somebody who is not so financially independent at the age of 22, he need not go for a genetic testing at all. So he should avoid getting a genetic testing, and do it only after a proper counseling. So he should understand the implications of it. What is he going to look at the age of 22? If he is ready to take the burden of all the information which is going to come with the test, then of course, yes, we can go ahead and do that. Of course, he should be a candidate for it, depending on the family history.
Great, great. So now finally, if I can just get your views, both of your views on what steps can individuals actually take to contribute towards the prevention of cancer, and also support those who are currently undergoing treatment in India. So what are the steps? What anything that you would want to, any message that you would want to give out? Dr. Nitin.
So, first of all, one thing that we need to realize is, uh, if you have any symptoms, you should not run away from it. For example, a simple symptom like having blood in stool, right? A lot of patients would present to us with blood in stools, and there are certain factors, certain parameters that help us decide whether this patient is at a high risk of developing cancer. Now, blood in stools can be from a simple benign disease like piles or hemorrhoids, as they call it, or it could be from a malignancy like a colorectal cancer. So first of all, the general population needs to realize that yes, nobody is immune to cancer. The only way to be immune to cancer is not to be born. So if you have a symptom which is known to which can be a harbinger of cancer, you need to get it evaluated as early as possible, because the earlier you get evaluated, the disease, the likelihood of picking it up at an early and a resectable or a curative stage, it is better. The more you delay it, the disease is likely to get metastasize or might be spread, and the chances of cure become less. So this is one thing that we need to understand. Second, those patients who I personally feel, those who are survivors of cancer, by meaning survivors of cancer, I mean those who have got cured and have had a long productive life after getting treated from cancer, they need to come out in the open and try to destigmatize the disease, the disease that cancer is. So we as healthcare professionals, we as healthcare institutes, and we as general population who are cancer survivors, we need to coordinate and bring this thing to a general public that yes, cancer is treatable, and it is not such a stigma that it used to be 25 years from now or 10-15 years from now. So even today you look at that, a lot of relatives would come in and talk to you, हमारे relatives से बात नहीं करना, he does not know about cancer, कि उसको cancer है. So that stigma of cancer, that mental stigma of cancer is still there, and I think we as the healthcare bodies should coordinate with these people who have actually that survived that treatment of cancer and are living a healthy productive life. We need to coordinate and bring it to the more general public. That's what, and I think a forum like yours can definitely help us do that. Dr. Peush.
Yeah. So as you asked that what steps for the general public, and I would say that and for the cancer survivors also. So I would say that important are three things. One is adoption of healthy lifestyle. We talk about this, keep on talking about this, but this is so important. And when we talk about healthy lifestyle, it is not just exercise, it is food that we eat. Food is a medicine, and inclusion of vegetables, fresh vegetables, and the seasonal fruits is so important. So because of the antioxidant that they carry, and cutting down on the red meat and processed meats. So this is also important, and processed foods. So food, exercise, and a good sleep. So de-stress is also important. This is as good for the general public, also for the cancer survivors. Number two is screening. Dr. Nitin just mentioned that you present early, and those are red flag signs. What he mentioned, that you immediately any change in the body, you please report it to your doctor, and please go for screening. So screening is you do not develop signs or symptoms, but still you have to go for a regular checkup. So please do it after the age of 50 years, at least once a year, and that's so important that India should actually start going towards that. Please take a health insurance. Health insurance is so important. We realize that only once we get the disease, then we realize. So please cover yourself with a health insurance, and make sure that you take a good health insurance that covers adequately. Number three is that treatment is getting better for cancer. there is a lot of hope. Once you're presenting early, go to a team of doctors, tumor boards, joint meetings. Comprehensive cancer institutes are now taking care of cancer well. So go with the hope, and I'm sure your doctor will, hold your hand and take the journey forward. So with this, I would say that, do not be afraid with cancer. There's a can in cancer. So thank you.
Very well said. Yes, definitely awareness is an important aspect, and as we come to a conclusion saying that early diagnosis is definitely going to work towards a prompt treatment. So creating awareness, and we definitely will be happy to share this awareness towards the general population, so that more and more people reach out and come and get their diagnosis done at a very early stage. So thank you, Dr. Nitin. Thank you, Dr. Peush, for joining us
Thank you,
today.
Dr.
And it was
Nandini.
lovely to
Thank
be
you.
Thank you,
interacting
Dr. Nidita.
with you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.